Are you in need of getting major dental work done and you need to get all of your teeth taken out and you're trying to explore all of your different options to figure out what is best for you? Well, I have personally gone through getting all of my teeth removed, getting dentures, and getting full dental implants. So I'm going to go over what the procedure was like for me on both of those things to help you make a better decision on what might be best for you. Okay, so first let's talk about dentures and what the procedure for dentures is like, or at least what it was like for me. I'm going to start this video by saying that if you go and get dentures or you go and get dental implants, it may be a little bit different for you what exactly you go through. But this is just generally what it is like for most people, what it was like for me. There may be certain things that are different just in your experience, just so you're aware. However, when I wanted to get dentures, when my teeth were rotting out of my face, hurting in pain, infected every day, like it was terrible. Ugh. I was lost. I'm sure just as many of you are now, trying to figure out what exactly I should do, how I was going to go about getting dentures, what that was like, what the steps were to get there. So the first thing that you need to do is, if you're going to be paying out of pocket, that's fine. But if you have insurance, you want to find out if your insurance is going to cover dentures or not. You need to figure out that with your policy, see what benefits they have, see if dentures are covered, and then figure out what dentist you can go to from there. After that, you need to book an appointment with the dentist, and they're going to go over, your history, take scans, all that kind of stuff, talk to you about the extraction surgery. Extraction surgery can look different for different people. For me, I have sensory processing disorder, I have autism, and PTSD. So they put me in a hospital setting to take my teeth out. I was put to sleep for it, thankfully. I was not awake at all. But there are different methods which different dentists use to extract all of your teeth. Some people I've heard were completely awake for it, just had numbing. Some people were given an oral conscious sedation where they just don't really remember most of it. It made them very calm. You want to talk with your dentist, of course, about what that's going to look like for you so you can be prepared. You'll get your extraction scheduled, and then this will also look different for other people. Some people will get what is called immediate dentures, or they're also called temporaries or healing dentures. And those are immediately placed in the mouth after you get all of your teeth extracted. And it makes it where, you don't have to go without teeth for a little bit. You can smile. They don't fit the best. In a lot of people's experience with temporaries, I didn't have temporaries. I had to wait 8 months toothless and then get my permanent dentures because that's just what my insurance would pay for. That's another thing when you check with your insurance, see if they do pay for temporaries or if you're going to have to wait for your permanents. If you do end up having to wait to get permanent dentures, it's going to be many months that you are toothless, just so you are aware and prepared. I was toothless, like I said, for 8 months while I waited. And the reason they do that is because your gums need time to recede. They're going to shrink for a while, and your denture's just not going to fit. I mean, you can get it done, but you're going to need to go in there and get a reline like every few weeks or something while you're healing. So most dentists will wait and put you in permanent dentures months after you've had extractions. So definitely talk with your dentist about what option is best for you, if you're going to get temporaries or if you're going to wait and get in permanents. So how it went for me is I had my extractions. I had to heal for 8 months. Then I went in and got my impressions for dentures. And what impressions are they like put this, I don't even know how to describe it, like a putty stuff. It's gross. I'm not gonna lie. Ugh, it's gross. As someone with sensory issues, it is not great. But they will put this stuff in your mouth. It kind of like is put on something that looks like a giant denture. I don't know, like a giant retainer case. I don't know what it is. But they'll put that impression stuff in there, and you have to like take deep breaths while they put it in there to take a mold of your gums. And then they will send that off either to a lab. Some places have their own lab. That's another thing you're going to want to talk to your dentist about is, are you going to have to send my teeth off to, a third party lab, or do you have your own lab? That's going to matter on like how quickly your denture is going to be able to be made. the dentist that I went to had to send them off to a third-party lab. So I had the impressions done, I had to wait a month, come in to get my dentures, and then I had to send them back to get adjusted at that point, because when I first got them, like when I would put them in, it was slanted like this. It was so weird. And I would have to like push up on one side with my thumb to make it fit. But that obviously wasn't ideal. So I had to send them back, and then I'd wait another 30 days to finally get my permanent set of dentures that I was able to wear. So you're gonna want to talk with your dentist about what the whole time frame is going to look for you, so you can prepare. If you're a person that works a 9-to-5 job, of course you're going to want to know how long you're going to be toothless and healing and all this good stuff. So that's what the experience was like with dentures for me personally. I went a whole year without a reline. I probably shouldn't have done that. I probably should have got a reline before then. So you're going to want to talk to your dentist and your insurance about if relines are covered, how often they're covered, all that kind of stuff. Because mine only covered them once a year. So that's why I was only in dentures just under a year and never had a reline. There are other things that you can use at home, like glues, things like cushion grip. That's what got me through, was cushion grip. But, you know, it's completely up to you. That's just what it's like getting dentures.